13 exercises to relieve hip, foot, knee, and back pain. Over 100 million Americans suffer from chronic knee pain. It's the second most common cause of chronic pain. In addition, between 15 to 20% of men endure knee pain, and about 20% of women are enduring knee pain. Aside from knee pain, people are constantly dealing with hip and foot pain as well. It can become a nuisance to deal with this pain, and it can affect your day-to-day routines. With that said, keep watching for exercises that can help the pain subside. Number 13, wall squats. If your knee is not 100%, the best thing to do is strengthening it with wall squats. Begin by standing with your back against the wall. With your feet shoulder-width apart, start slowly bending your knees. If you feel any pain, stand upright and take a break. If you're feeling no pain, continue bending your knees and keep your back and pelvis against the wall. Hold this position for about 10 seconds. The goal is not to bend your knees too deep. Repeat this exercise a few times and try to hold the position a few seconds longer each time. Number 12, bridging. Be sure not to overarch your back by tightening your abdominal muscles before lifting. Lie on your back with your knees bent and your heels on the floor. Push your heels into the floor and begin to squeeze your buttocks and lift your hips off the floor until your shoulders, hips, and knees are all in a straight line. Number 11, step-ups. This is an exercise that'll put a bit more strain on your knee, so it's important to take it slow. For this exercise, begin by placing one foot on the step bench or the lowest step on a staircase. Keeping your pelvis level, start slowly bending your knee and lowering the opposite foot on the floor. Touch your toe to the floor and raise it back up. Number 10, pelvic tilts. This will help build strength in your pelvic muscles and lower back. Lie on your back with your knees bent and your feet flat on the floor. Tighten your stomach muscles. You should feel your back pressing against the floor and your pelvis rocking back as well. Number 9, heel pumper. Jillian Michaels, a famous American personal trainer, suggests that people who have pain in the balls of their feet should do this heel pumps exercise. To start this exercise, Jillian says to sit on the bottom step of a set of stairs and place a tennis ball under the heel of each foot. Begin using the body weight to create resistance by leaning your forearms on your knees. Once you've done that, start pumping your heels up and down on the tennis ball. Do this exercise for 2 minutes and then walk around and you'll feel the tension releasing on the balls of your feet. Number 8, knee to chest exercise. Lay on your back with your knees bent and your feet flat on the floor. Raise one knee to your chest and keep your lower back pressed on the floor. Hold this position for about 30 seconds, then lower it back to the ground. Number 7, wall push. The wall push exercise is one of the best exercises to do for foot pain. For this exercise, start by facing the wall and put both hands on the wall. Make sure they're shoulder height. Then place one foot in front of the other. The front foot should be about 30 centimeters from the wall. Next, bend your front knee towards the wall while keeping the back knee straight. Number 6, bird dog. Keep in mind that you should only raise the limbs to heights where your lower back position can be maintained. Begin on your hands and knees and tighten your stomach muscles. Lift and extend either your right or left leg. Do this 8 to 12 times for each leg. Number 5, hip bridges. Hip bridges will help engage your hip flexors, glutes, and hamstrings. Begin by lying flat on your back with your feet flat on the ground with your legs bent. Next, use the weight from your heels to lift your hips up so they're in line with your knees and shoulders. If you're doing it correctly, you should feel a driving motion in your glutes and hamstrings. Number 4, lying lateral leg raises. Lying lateral leg raises will help strengthen your iliotibial band. This band is partially responsible for your side-to-side leg motions. To perform this exercise, lie on your right side and extend your right arm out for balance. Then, lift your left leg as high as you possibly can. Then slowly bring your left leg back down so it's back in line with your right leg. Number 3. Partial crunches. First, lie on your back with your knees bent and your feet flat on the floor. You can either cross your arms over your chest or put your hands behind your neck. Tighten your stomach muscles and begin to raise your shoulders off the ground. As you raise your shoulders, breathe out. Go back down and repeat. This will help tighten your core and improve your abdominal strength, which will provide you with overall stability and improved function of your main core muscles. This will help you move around easier and reduce tension on your pain areas. Number 2. Wall sits. Stand 10 to 12 inches from the wall, then lean back. Have your back flat against the wall. Begin to slowly slide down the wall until your knees are bent and your lower back is pressed against the wall. You may find that this one is difficult to do at first, especially if you don't have much lower body strength, but keep at it. If you continue to do this exercise, you'll notice that after a few weeks your leg strength will start to improve. Number 1. Press up back extensions. Lie on your stomach with your hands underneath your shoulders. Begin by pushing up your hands so your shoulders begin to lift off the floor. Try to hold this position for a few seconds before resetting. Now that you know what exercises and stretches you should do to help relieve foot, back, knee, or hip pain, here's one form of exercise that you should probably avoid if you experience chronic pain. Lifting weights. If you have an acute back, foot, knee, or hip pain, lifting weights can help relieve it. But if you have chronic back pain, you should not be lifting weights because it could cause further pain and injury. You're also even more at risk to injuring yourself further when you're lifting weights if you're using improper form. So if you're new to the gym or just want to make sure that you're lifting weights safely, it may be a good idea to hire a personal trainer who can ensure to you that you're using the correct form. This way, you can avoid hurting or injuring yourself. What are some exercises and stretches you perform to get rid of pain in certain areas of your body? Let us know in the comment section below.
Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of Bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.